Thank you very much, Matthew, for that warm introduction, and good morning, colleagues and visitors. It's wonderful to be here this morning at our second conference that we have now with the EPA, and I really would like to thank my colleagues within the EPA, Laura, Jonathan, Deirdre and others for your leadership in working with us and for the approach that you take to partnership and to working with us, and for all of us looking at our boundaries of where our remits end, where yours begin, but trying to look at the merge and the interface between it, so that we can do more together. Myself and Laura met very shortly after the last conference to look at the feedback that everybody had provided, and we sat down and went through it and thought about how we could have a conference that in some ways provides space for us to be able to actually think, and for our colleagues to be able to think about kind of what initiatives or work that we have ongoing that we can add a further dimension to add better value to it. And we thought that maybe if we had a clearer focus in this conference on the whole idea of participation, engagement, community enablement and involvement with the broader health and wellbeing agenda and how that relates to the environment. We certainly know that within health and wellbeing that the whole policy domains of citizen engagement will be the hallmark of our success into the future, enabling citizens and communities to play their part in improving the health and wellbeing of the population and protecting the environment. And a key question for us as we're implementing the Healthy Ireland framework cross-sectorally is how are our actions and how is our support and the partnerships that we're building helping us to build what we consider is the essence of this, which is a social movement for health and wellbeing improvement in Ireland. And you can't do that clearly without factoring in the environment, which is a critical part of it. So today we have a range of presentations from people who are doing practical work on the ground and also research work, doing exactly that, looking at it from different perspectives, but with a similar intent in mind. And for those of you who are more from the environment side of the house, and also some of our international colleagues who are here today, I might just talk about the Healthy Ireland framework and I suppose how participation has very much been threaded through the work that we're trying to do. Healthy Ireland is the Irish government's response to, I suppose, increasing health inequalities and increasing risk factors within the population for chronic disease and so on and so forth. And the overarching goals are around improving population health, reducing health inequalities, protecting the public from threats to health and wellbeing, and enabling every sector of society and community to play its part. And the framework was published over 4 years ago now. And it's wonderful that it's actually still here. We've gone through 2 political cycles, one just averted yesterday, which is quite good. We've gone through 3 ministers for health, and the agenda is very much growing in a way that I think we can all be proud of, because it's very much focused on the long term. What are the kinds of enabling structures and infrastructure that we need to put in place across our organisations to be here for the long haul? It's wonderful that when our current Taoiseach was Minister for Health, he was very supportive of the agenda, and it's really good to see that he is taking an active interest in supporting it now from his office in the department of the Taoiseach. And there has been progress across a broad range of what's considered in the literature to be the kind of best buys for addressing these wicked problems. Sorry to be using all these terms, but that's the sort of the way that I suppose our narrative is kind of coalescing around the challenges to delivering on what is a really kind of big ask around population health improvement and reducing health inequalities. It gets to obviously the broader social determinants of health and kind of core policy issues that are always very challenging to be able to address at a national level and at a macro level for everybody within society. But we've had significant progression from with regard to actual policies and policy frameworks within the Department of Health. So since the framework was launched, we've had a physical activity plan for Ireland, a healthy weight plan for Ireland. We've had the introduction of the sugared sweetened tax, the announcement that it will be introduced. We've had the public health alcohol bill going through the houses of the Oireachtas, which is really, really positive. On the public health service side of the house within the HSE, we've put a big focus over the last 4 years on strengthening the infrastructure for implementation and making sure that we're building sustainability into the core health service. So it's not just our public health colleagues and our health promotion colleagues that are driving this agenda, but it's actually the core elements of kind of healthcare delivery, all of our doctors, all of our nurses, and the tens of thousands of people that work in the health services caring for people every day. So we've established policy priority leads and small teams across all of the key policy domains, responding to government policy, developing implementation plans agreed across services in order to bring those policies to life in very practical, tangible ways that make sense for the health service, and having stakeholder groups, cross-sectoral stakeholder groups aligned to each of those policy priority areas. So for example, healthy eating, active living, tobacco, child health, alcohol, well-being, and so on and so forth. We also have put in place heads of service, heads of health and wellbeing within each of our community healthcare organisations to lead on this agenda and work across the hospital groups. And we've actually developed then local Healthy Ireland plans. So we've taken the national framework, we've internalised it for the HSE by developing an actual implementation plan for our services, looking across all of them. And then within each of our hospital groups, within each of our community healthcare organisations, we have structures in place, leads in place, and plans in place to bring the policy to life. So we have 5 out of our 6 hospital groups, 7 hospital groups if you include the Children's Hospital, now have published Healthy Ireland implementation plans, and all of our community healthcare organisations are currently developing them, and they'll all be launched by the end of Q1 next year, with one ready over the next couple of weeks. And I suppose the sort of principles underpinning those are very much dear and close to the principles underpinning the Healthy Ireland framework to begin with, but it's around capacity building, it's around partnership, and it's around mobilisation. Where we also bring together all of our representatives within the health service who sit on the local community development committees across our local authorities. We bring all of those people together regularly throughout the year, and now we've started to add to that our representatives who sit on children and young persons committees across all of the local authority structures, so that we can enable, resource, educate and align the thinking and the practice at a very local level with regard to what we're doing in the health service to implement it and bring that expertise to bear in a very unique way with our partners across local government. And that work is going really well, and it's very much supported by the government departments involved in supporting that work as well. This year we had a really good development also. The Department of Health managed to secure funding, a Healthy Ireland fund, so as to be able to provide financial support to local authorities through the local community development committee infrastructure. And we've been working closely with the department and those people that I mentioned that we bring together on the ground frequently to work through those local community structures. We were involved in developing proposals and funding applications to support the work of Healthy Ireland at the local level within communities. And other significant, I think, markers of success and of a real intent to deliver on this agenda is the Age-Friendly Ireland alliances that were led out by local authorities, but with funding that came from philanthropy. And all of the city and county councillors have agreed that that project will be mainstreamed and that they will be supporting that themselves in partnership with a range of stakeholders, including ourselves, to sustain that model at the local level. And there's a big recognition there. There's kind of local older persons committees within every county council and city council in the country, working together with those local authorities and stakeholder groups to identify tangible actions that can be taken at a local level to ensure that communities are a better place for people to age and age well in. And they have a whole host of really practical things that can be done at a local level and that are being done at a local level. And it's wonderful that our city and county managers are really pioneering within this field, and there's a big recognition that a lot of the work that has been happening through different work streams like Age-Friendly, Health and Wellbeing, Healthy Ireland, there's a coalescence. At last year's conference we spoke about the need for policy convergence across a lot of these areas. There's still quite a lot of work to be done there, but again within the local authority space we can see that policy convergence happening. Limerick launched their kind of Healthy Ireland kind of city recently, trying to bring together the Healthy and City Counties framework, WHO-based framework, their age-friendly framework, and their kind of health and wellbeing plan into one particular kind of plan for the county, using all of the structures that they've put in place to ensure that their local communities are engaged in the decisions that are happening at a county level. The other thing that happened this year, and for those of you that aren't aware of it, it's a really important one for you to consider with regard to your roles in the organisations that you work within, but as part of the work of the Healthy Ireland Council, which was established, I think 3 years ago now, and it's finished its first term, and I was a member of it, we developed a Healthy Ireland network. And the idea was to try to build an advocacy and a information and a kind of partnership network around the country of individuals, community organisations, private sector, businesses, all with the singular intent around signing up to a Healthy Ireland Charter, and within those community organisations or private sector businesses identifying what are the things that we can uniquely bring to this agenda. I just wrote down here the elements of the Charter because I think you'll be interested in it. But the network will support, advocate and ensure that the Healthy Ireland message is shared, understood and brought to life throughout society. Now more than ever, there's an unparalleled opportunity for us to embrace health and well-being, to be the pioneers of a national movement that will support health and our communities for generations to come. We recognise that we can achieve a healthier Ireland only by reducing health inequalities and fostering a culture where health and well-being is prioritised by all and for all. And in signing up to the Charter, you sign up to the principles and the values around championing the goals, championing the values, identifying opportunities and strengthened partnerships, bringing to life some of the work within those organisations, and ensuring that Healthy Ireland is a driver for our nation's progress socially, culturally and economically. And I think there was over 300 organisations that signed up to the network on the day, but many of those having kind of thousands of employees, a number of them, and quite a number of them then having kind of hundreds of related organisations or members. In relation to that, we've got a bit of work to do with the department in really enabling the network to actually do that work and supporting it. What we have been doing within the health service is further developing and extending our campaigns and our materials so that those kinds of organisations and community groups will have those resources, a kind of a toolkit to use, whether that's in the area of the lifestyle determinants, or as Laura and I was discussing, whether that can be in some areas of the environment also. So for example, we have a new Ask About Alcohol website. We've extended all of our work in terms of tobacco cessation. We've got an online community now of tens of thousands of people who are active quitters, a quit community supporting one another to quit, which is really interesting from a service delivery model. So we've moved from sort of face-to-face counselling into sort of live chat and people really wanting to just get the supports online, and then to actually communities supporting one another with their own thoughts and their ideas, and then we just a €30 voucher once a month for the quitter of the month, and they put up their thoughts and ideas about how they're managing to give up cigarettes. And then moving on to areas just even like dementia, we have significant increases in dementia as the population grows and ages, as we know, and there's a lot of people directly impacted with family members suffering from dementia, and we have established a new campaign with many organisations ranging from An Post to Bank of Ireland to community groups to try and understand together. That's the strapline of the campaign, so that people with dementia, we can address some of the stigma attached to it, and we can enable people within communities to recognise and understand the signs of symptoms and to support people to continue with their daily lives for as long as they can with that condition. And public engagement and citizen activation is the cornerstone of that work also. So I think it would be fair to say, Laura, that you and I both think that there's an awful lot more that we can do within this space to really align up the environment agenda with what we're trying to do. Clearly there are major environmental determinants of some of the work that we do, and there are also major environmental benefits to some of the work that we do, whether it's in those core policy priority domains around the lifestyle determinants. But even more broadly, Kevin Kelleher reminded me last night, he's the head of health protection in the health service, that Dame Sally Davis, who's the UK CMO, said that antimicrobial resistance is now a bigger threat to the UK than terrorism. And right now in Ireland we have the pleasure of having weekly meetings in the Department of Health to discuss CPE, carbapenem-resistant enterobacteria. It's a mouthful, a particular bug that is very resistant to antibiotics, and following serious concern raised by the Director General of the HSE to the Minister has declared a public health emergency with regard to this bug, which is, as I say, very highly resistant to antibiotics. And in July this year, we identified the first strain of this bug that is resistant to the last remaining antibiotic, colistin, that currently treats it. So if we are to contain it, and we think that it is containable, and you might remember, for those of you that were here last year, Professor Martin Cormacan spoke really plainly and eloquently, as he does, describing some of the threats to health from the environment and what we need to do about it. And he is the lead of our national response team in relation to dealing with this threat. And clearly there's a significant linkage there between the environment and the role that it plays. And there is a significant amount of emergent literature in that field that people in this audience will know far more about than I do. And again, even with something like antimicrobial resistance, without active and engaged citizenship and participation and increased knowledge levels and dialogue regarding what this threat means at a very practical level in terms of our hospitals, when we tell people you can't visit for the following reasons, we will not be successful at bringing it under control. So there's a whole range of areas and a whole range of, I suppose, knowledge that we now have through interdisciplinary research, where we have psychologists and behavioural economics, and we have people working in planning and architecture, and a whole range of areas, toxicology, microbiology, where the learning from these disciplines relates across the policy spectrum as it relates to that broad area of what kind of environments do we want to live in, what kind of communities do we want to nourish, and do we want to grow. And I hope that maybe today that there'll be some thoughts and ideas with regard to some kind of tangible things that we can do to further that agenda. We have some really wonderful speakers, and I would like to thank sincerely all of them for coming. We have John Ryan, who's the Director of the European Commission for Health and Food Safety. It's great to have you here, John. And John's going to be talking about the kind of nexus between environment and health, and I'm really interested to hear your thoughts from a European level. Simon O'Rafferty is going to be talking to us on something that sounds really interesting, product design-led approach to public engagement. We have Iski Britton talking about her research funded by the EPA and the HSE about social innovation, participation and policy, and a whole lot of other speakers in the afternoon talking about some of the practical work that they're doing at a local level to further this agenda. So I hope that we have a really stimulating and exciting day, and I'm really interested in any feedback or thoughts that people have with regard to how we can do it better, or some practical work that we can take away with us as a result of today's event. So thank you very much.